Hello, my name is Rachel Helt, and today I will be discussing my final project for Management 551, Operational Analysis. The focus of my project was on the influence of lean methodology on patient experience in hospitals across the United States. During my presentation, I will be discussing the background of the project, the ways in which I evaluated lean hospitals, the insights I learned, and the recommendations that can be made to future hospitals using lean methodology to improve patient experience. Healthcare in the United States is big business. In 2013, Americans spent a combined $2.9 trillion on healthcare-related expenses. And out of that $2.9 trillion, $936.9 billion was spent on hospital-related expenses. With this type of investment in Medicare and Medicaid covering the majority of these costs, both patients and government agencies wanted to provide the highest quality care available. In response to these demands, the CMS wanted to find a way to measure patient perspective. Starting in 2002, the CMS partnered with the Agency for Healthcare Research and Quality to create the HCAHPS survey. The HCAHPS survey is a standardized survey instrument and data collection methodology that measures patients' perspective of hospital care. This survey created a national standard for collecting and reporting information that facilitates comparisons across hospitals to support consumer choice. HCAHPS scores have become increasingly important to hospital executives as not only a measure of quality, but also of a gauge for the amount of reimbursement their hospital will receive. The HCAHPS scores a hospital receives determines 30% of the total incentive offered under the hospital value-based purchasing program. Over the last decade, lean methodology has been carried over to healthcare and as a way to cut costs and improve processes. According to the extensive research I read, lean also improves patient experience. The goal for this project is to identify how lean has successfully been implemented in hospitals and subsequently improve patient experience. The analysis was done through research of various techniques that have been taken from the manufacturing industry and adapted to healthcare. The comparison of HCAHPS scores for hospitals with lean programs. To evaluate the impact lean had on patient experience, I took two specific healthcare systems that had fully embraced lean methodology. Beginning in 2002, both ThedaCare and Virginia Mason Medical Center saw the need for improvement and began applying lean principles to their organization. Each system focused on different areas of improvement, but both have achieved significant results through lean thinking. To fully understand the impact of lean methodology on patient experience in hospitals, it was necessary to evaluate HCAHPS scores. Comparing the HCAHPS scores of lean hospitals to the scores of hospitals that have not implemented a lean approach provided an understanding of the impact on patient experience. The hospitals that have not implemented lean methodologies were chosen based on the number of beds and for a local perspective. ThedaCare Regional Medical Center was compared to St. Elizabeth Fort Thomas Hospital, and Virginia Mason Medical Center was compared to Bethesda North Hospital. A crucial component of lean thinking is its ongoing and incremental improvements. For the comparison of lean versus non-lean hospitals, the average HCAHPS scores for each category from the past 5 years was used. This time frame allowed the organization to show the ways it was able to make improvements over time. The graphs on this slide and the following slide show the comparison of Virginia Mason Medical Center and Bethesda North Hospital HCAHPS scores for the past 5 years. It can be seen that there was not a significant difference between the two organizations. This was a very shocking finding because the research had shown there to be a significant improvement in patient experience as a result of lean. The findings from the comparison of lean and non-lean hospitals did not identify the ways lean implementation made improvements to patient experience. Considering this disappointing discovery, it is necessary to recognize what is preventing lean methodologies from directly impacting patient satisfaction. The theory of constraints identifies the limiting factor that stands in the way of achieving a goal and then systematically improves that constraint until it is no longer the limiting factor. In the case of lean practice and patient experience, the limiting factor can be identified as the prioritization of the patient experience. To overcome this barrier, the theory of constraints provides a significant methodology that can be used in the future for identifying and eliminating constraints. This is known as the 5 focusing steps. The purpose of this project was to identify how lean methodology was successfully implemented in hospitals and has subsequently improved patient experience. Although it was found that lean implementation did not have a notable impact on the HCAHPS scores of the hospitals using the methodologies, it can be suggested that the overall increased efficiency of a lean hospital leads to an indirect improvement in patient experience. Thank you for your time today, and I hope you learned more about the ways lean methodology has influenced patient experience in hospitals.